I'm Tony Sklar with bnetTV. We are here at the mHealth Summit for 2012 in Washington, D.C. I am speaking with Dr. Michael Eiffert of DoctorCom. How are you today, sir?
I'm doing well, Tony. Thanks.
Thank you very much for coming on the show. I very much appreciate that. And for all of the people out there in bnetTV land, why don't you give us a brief overview of what DoctorCom is and what are you doing here at the mHealth Summit?
Yes, well, DoctorCom provides HIPAA compliant communication solutions for hospitals, their clinics, including all of the nurses and doctors and other stakeholders within the community surrounding the hospital. So we connect everyone into a HIPAA compliant communication network that consists of telephony, secure messaging, and file sharing. File sharing of any sort. It could be EKGs all the way up to whole MRI scans.
So I've spoken with a lot of companies about HIPAA compliancy, but one thing that I've actually never done for our audience is I want you to explain to them what HIPAA compliancy is.
Well, HIPAA compliance is a set of standards mandated by the government, and so you have to build your system around those guidelines.
And they would be?
And they would be various encryption methodologies to make sure that it meets a minimum standard, the storage of that information, and also the end user devices and how the end user device is secured. So, and DoctorCom has worked through all of those issues, and we have what we think is a very excellent product for nurses and physicians for their communication on a day-to-day basis or an hour-to-hour basis. Now, as a practicing physician, I can tell you that nurse-to-doctor communication is one of the biggest pain points for hospitals. Connecting nurses to the right doctor at the right time is a very difficult challenge, and it leads to a lot of frustration. So DoctorCom solves that pain point by allowing them to communicate seamlessly via an iPhone or Android app, or they can use a web interface on any device that has an internet connection, and it can do so using our secure network.
No, well, so, continue to go on here, but continue to go on.
So, doctors no longer need to give out their private contact information to nurses. The nurses can simply find the physician within DoctorCom that they need to communicate with. They can click to call, they can send a message. If they want, they can attach an EKG or other file to the message and send that off to the doctor. Now, if the doctor that they've chosen is not on call for their specific group, DoctorCom tracks the call schedules for those individual physician teams or practices and will reroute the message to the on-call doctor after hours as part of our service.
So tell me a little bit about the importance then of being able to get that information to the right doctor as opposed to the old school way that it was happening.
So right now, at most hospitals, nurses are calling answering services, trying to track down the right physician. They're leaving a message with an operator who then has to page the on-call doctor and hand off the message or send a non-secure SMS message to the mobile device of the doctor. With DoctorCom, they can send the message directly through a HIPAA-compliant secure messaging system, or they can click to call. So there's no middleman, and we reduce costs, streamline the process. We also get rid of the frustration of having to wait for the doctor to call back. The doctor then has to hope that the right nurse answers the phone at the nurse's station or at the right or the practice. So we reduce the pain and friction points for the nurses and the doctors at both sides of the communication spectrum.
How easy is it to implement? Is it available today? And what's the cost structure that's surrounding it?
It's available today. We're rolling out with Adventist of Northern California with 5 of their campuses. We're rolling out with all of the physicians and nurses. The nurses will be using the communication platform with the physicians and their practices. We have a referral module which will help Adventists retain referrals within network and also draw referrals from outside of their network, which is exciting. It's
very exciting.
So we're also working with all of their satellite offices to connect them within this HIPAA compliant network as well.
And then finally, Michael, what are we going to see from DoctorCom here in the future?
Well, DoctorCom is about to close on a number of other deals, including some major laboratory deals, major laboratory companies within the US and in Europe, and that will allow for real-time results reporting of critical lab values. For instance, if the lab comes back with a potassium level of 8, which would be a critical value, we can route that to the right doctor at the right time, regardless of where they are, so that the lab knows that the the lab value will be acted upon by a physician. The physician can confirm to the lab that they received that value. Then they can call in either to the patient or to the nurse, and they can do so in a way through their mobile application that, again, protects the privacy of the contact information of the physician, which is a big win-win for everybody.
It sounds like you're well positioned within this market space at the right time. Michael, thank you so much for taking the opportunity to speak with us. I hope we get a chance for an update again in the future.
Okay, thanks, Tony. I appreciate it.
Thank you very much. I've been speaking with Michael Eiffert from DoctorCom here at the mHealth Summit 2013. I'm Tony Sklar with bnetTV.